Environment check. I'm washing my hands and providing privacy. Hi, Mr. Gillespie. How are you doing today?
I am doing well. How are you?
I'm good. My name is Shelby, and I'm your nurse today. Can you just verify your name and date of birth for me?
Name is Dwayne Gillespie. October 16th, 1987 is the birthday.
Okay. I'm just going to ask you a couple questions. Well, first, I'm going to tell you that we're doing a head-to-chest examination today. It's going to take about 15 minutes. Is that okay?
Yes.
All right. And I'm going to start off with a few questions. Do you have any allergies?
No.
Do you know where you are?
In the hospital.
Do you know why you're here today?
Head to chest exam.
And do you know what day of the week it is?
It's Friday.
All right. On a scale of 0 to 10, what is your pain level today?
Pain level is 0.
0? Okay. So, starting with the general appearance, patient is alert and oriented times 4, is in no acute distress. His speech, mood, and affect are appropriate to the situation. His facial expressions are also appropriate to the situation. I'm going to start by assessing your skin. So on assessment of the skin tone is even throughout. It is warm and dry. I see no wounds, lesions, or incisions. Capillary refill is 2 seconds. The nail beds are pink, slightly curved with no clubbing. So I'm going to look at your head. On palpation of the head, there's no lesions or infestations noted. The facial features are symmetrical without drooping. I will go and look at your eyes now. So externally, there are no redness or discharge on the eyes. The conjunctiva is moist and pink, and the sclera is white. I'll have you follow my pen light. Pupils are 3 millimeters, equal, round, and reactive to light and accommodation. On inspection of the ears, there's no redness, discharge, or swelling. Based on our conversation today, there's no hearing loss noted. I'm going to look at your nose. Look up for me. The nose is symmetric with no deformities or inflammation. I'm going to have you plug one side of your nostrils for me and then the other side. All right, both nares are patent with no drainage. I'm going to look at your mouth now. The lips, tongue, and gums are all pink, moist, and intact. Next, I'm going to inspect the chest before I listen to your lungs. So on inspection of the chest, there is no barrel chest or deformities noted. There's also no respiratory distress or accessory muscle use noted. Now I'm going to listen to your lungs. Normally this would be done on bare skin. So on the right side there are 3 lobes, on the left side there's 2. So I'm going to listen to the right upper, the left upper, the right middle, the left lower, and the right lower. All right, and I'll have you turn around for me. We're going to listen in 6 different spots on the back. We'll start with the left upper, right upper, left lower, right lower, left lower, and right lower. All right, the lungs are clear bilaterally. So next we'll do the cardiac portion of the exam. I'm just going to feel for your carotid pulse, which is on either side of the trachea. The carotid pulse is 2+, and the rate and rhythm is regular bilaterally. So for this portion, the patient would be sitting back at a 45-degree angle. I'm going to have you turn your head to the left. On inspection of JVD, there's no JVD noted. So now I'm going to listen to your heart. Normally this would be on bare skin. So I'm going to start by listening with the diaphragm of the stethoscope. I'm going to start by listening to the aortic valve, the pulmonic valve, Erb's point, tricuspid, and the mitral valve. S1 and S2 are heard throughout. Next, I'm going to be listening with the bell of the stethoscope on all the points again, the aortic valve, pulmonic valve, Erb's point, tricuspid, and mitral. There are no murmurs heard throughout. Next, I'm just going to feel your radial pulse. The radial pulse is 86. The rate and rhythm is regular bilaterally. That concludes our exam for today. Do you have any questions for me?
No.
On a scale of 0 to 10, are you in any pain?
0.
0. All right. Well, thank you for your time. I'm washing my hands.